Hello and welcome to In Service of Health, brought to you by the Public Health Accreditation Board. This is the podcast that brings healthcare and public health leaders together to inspire new thinking for healthier populations. In this episode, I was delighted to sit down with Dr. Bill Winkenwerder. He is a physician and chairman of Winkenwerder Strategies, a healthcare advisory and investment firm. He is also chair of the board of CitiusTech, a healthcare tech services company that serves providers, healthcare organizations, and pharmaceutical companies. He has enjoyed a long career that spans the public and private sectors, and we sit down to talk about leadership, the opportunities and risks of new technologies and AI, and ways to lean into trust and collaboration. I hope you enjoy the episode. Dr. Winkenwerder, thank you so much for joining us on the podcast today.
Thank you. It's great to be here.
Absolutely, absolutely. So let's jump right in. Why don't we start by just tell us about your work. You've had a storied career across multiple organizations, multiple sectors. What really motivates you to do this work?
Great question. I would trace it back to my youth, early days, when I decided that I wanted to be a physician. And I had no physicians in my family, but there were doctors in the community, and I admired them. I admired them for, their professionalism, their standing in the community, the fact that they in those days, ran their own businesses. And it just so happens that those physicians that appealed to me were also involved in the community and community leadership and things like that. So that just looked like a really interesting career to me. And so that led me to, go off to college with a plan to go to medical school. And there's a lot after that, but that's what motivated me. And in many ways, it still does.
That resonates with me as well. Certainly no physicians in my family, but I really love the concept of helping people and helping my community. So thank you for that.
Absolutely.
Talk to us a bit about public health. We are the Public Health Accreditation Board. We do advance supporting local, state, territorial, tribal health departments. Tell us about your particular definition of public health and why it is important to you and to society.
Yeah. Public health is very important to all of society, and I'm not sure that you can achieve health for a population of people without public health efforts. To me, public health means all the systems, programs, activities, efforts to reach and connect with every individual, every family, to help them better understand how they can influence, how they can maintain, how they can improve their own health.
I appreciate that and how you're really elevating the importance of individuals while also making a nod to the important role of physicians, of structures,
Yes.
of institutions, and the conditions in which people live as well. And to your point, it won't happen on its own. There has to be intentional effort made to improve the health of the public. So let's switch gears a little bit. You were on the front lines of the beginning of electronic health records.
Yes.
And my perspective is that despite all of the advancements that we have, we still have a way to go with EHRs. I'm a practicing ER doc, and I don't want to tell you how many clicks it takes for me to order something
Yes.
whatever. But whether it's EHRs, interoperability, optimizing technology to support healthcare delivery, from your perspective, what are some of the most important advancements in leveraging technology in healthcare over the past decade or so? And
Yeah.
along with that, what's holding us back from fully realizing our potential?
Yeah. Well, to answer your question first, the most important things from a technology standpoint over the last decade, I think that it's hard to put your finger on one thing, but certainly it is, if I could capsulize it, the use of data and the use of information and interoperable, bringing information, valuable information to the point of decision, whether it's a decision for a nurse, a doctor, a patient, anybody within the healthcare system, and making good decisions all along the way is critical to getting a good outcome. My interest in electronic health records goes back about 35 years, believe it or not, to around 1990. And it was at that time when I was a medical director with the Kaiser Permanente organization, who is now well known for its use of electronic records. In those days, they did not have electronic records, but it was a big organization, and it just seemed to make sense to me that they should have the wherewithal, have the vision to pursue an electronic health record system. And what made sense about that to me was that you collect that information, it's there, it's retrieved, it's there for the whoever, the doctor or whoever follows that initial visit to see and understand, to continue the care without having to always look it up or having information that gets lost or misplaced. And so those were the early days of the early systems. Even a big system like Epic was only used by a few hundreds of doctors around the country. But by the end of the 1990s, Epic and some others began to be used, across the system. And then I would say from the early to mid 2000s until the adoption of legislation that occurred in the early days of President Obama's administration that put a lot more money into incentivizing the adoption of electronic records. Until that happened, it was sort of catch and miss. But since that time, as about 15 years ago, there's been a rapid adoption of electronic records and what we now call digital health, because it goes beyond records to a whole bunch of other things as well, as you well know.
Yeah, yeah. Thank you for that, and really the importance of, again. I do remember, like, we had T-sheets and whatever it was when I was
Yeah.
doing my medical training. It was just pieces of paper. You would scribble something, and who
Yes.
knows, the next provider could read what you wrote or not. So we certainly have come a long way. And I love what you said about putting the data at the point of care so that clinicians can actually make accurate, appropriate, and quick, right? Quick,
Yes.
speedy decisions for the patient, right? So I really appreciate that. What do you think is holding us back? You talked about incentives. Are the incentives enough? Do we have enough interoperability? Where are there some places where we can do even better?
Yeah. There are lots of areas. I think we need incentives in many ways, and that would be direct. So, in other words, either a system or a clinician somehow getting rewarded, even small amounts of payment, for doing things properly. But I think, it's not just doing things properly. I think most physicians, with a little bit of assist from the information, will largely make correct decisions. And so today, I think a lot of the focus, especially with AI, is pulling all that information together and not just having it there, but having intelligence,
Hmm.
if you will, comb through the information and then present the optimal or optimized decision choices. So I think that's where things are going to go now and go forward, is toward a world in which their AI will present information, and the sort of the technology to accomplish that will be fused into electronic health record systems or alongside them and portable into them, so that clinicians can ask questions, query, even present a whole patient with all the data and get guidance. And I see that coming down the pike pretty quickly, amazingly so, because these large language models of AI are, moving right along.
Right, right. And it's already being used in the clinical space. I mean, I've had
Yes.
a provider visit where they have their phone on and it's just like right there, and then they spit out
Yeah,
a note afterwards, right? And so
absolutely.
I think these technologies are already being leveraged. Um, so your current role, focuses on investing in healthcare, advising many early stage startups, and you were right there.
Mhm.
So you really have a unique view of health tech innovation. Do
Mhm.
you believe there are innovations in particular in the health tech space that will fundamentally change how healthcare is delivered in the next 5 years, whether it's a new technology, a new diagnostic, some type of new intervention? Where do you see this going?
Yes. Well, it's a little bit difficult to predict with precision, what's going to be the next new big thing.
Right.
But I think we can pretty safely say that AI and sort of the derivative of that agentic AI, that is where you've got a bot or you've got this thing that can pull together information in an automated way, doesn't have to come back immediately to a human to process, but this other thing can process that information in an automated way, and then channel information to somebody who wants it next or at that point or in response to a query, question, what have you. So I think we'll see a lot in that interface between the doctor and the machine, if you will, or the doctor and the record system. But I think we'll also see this new AI technology be applied across the board to the processes.
Mhm.
Let's say, in supply chain for materials, in revenue cycle, in billing, in patient engagement, in all of these other areas where call centers, for example, there are a lot of people and a lot of the taskings are pretty routine. So that's where AI can come in and do things in a far more automated way. A little bit of concern there for what does that mean for people who lose jobs. I think we're all thinking about that now with the onset, the introduction of AI in so many areas of society. But I think for healthcare, it has the promise of bringing about some cost efficiencies. And goodness, we need all that we can get in terms of more cost effectiveness and cost efficiency. So I'm pretty optimistic about AI and healthcare.
Yeah. Yeah. As you know, AI is here. It's like, the internet decades ago. Like
Yeah,
you can be skeptical if you want, but it is here and it is going to change the way that we operate in many different parts of our lives. And you noted, not just what the doctor does, but the behind the scenes processes. You also talked about patient engagement. But also, I think underpinning what you said is this concept of trust. A
Mhm.
lot of folks, and dare I say rightfully so, have a little bit of maybe healthy skepticism,
Absolutely.
or caution around
Yes.
AI,
Yes.
which is a barrier to adoption and integration. How do organizations go about building this trust, but also making sure the AI is actually trustworthy? What are those back end
Yeah.
systems and processes
Great.
that to put in place to make sure you can and should trust AI?
Great question. And it is, I think it's the issue when it comes to the adoption, dissemination, use of AI is trust. It really has to be built on trust. And so, how do you do that? How does a system, whether it's a healthcare delivery system, a medical device system, a pharmaceutical company, how do they do that? I think it is by stepping back before and as you go along introducing these AI tools, you have to look at the big picture and look at the ways in which things could go wrong or could be damaged if there's a loss of trust. And
Mhm.
if people don't believe the information or their mistakes, too many mistakes, then you've got an issue where people will just reject or they just don't trust it. It's kind of like
Mhm.
asking the question about how people feel about the news today. The level of trust is probably the lowest it's been, at least in my lifetime. And I think that has a corrosive effect. It keeps people from, people not trusting things in large, proportions, holds things back. And it also creates conflict and angst and, worry, a lot of things. So it really is a balance, as you said, because you want skepticism and you want a little bit of distrust, so to speak. But then again, at the end of the day, you want most people, including ourselves, to trust
Mhm.
what they're seeing, what they're reading, what they're hearing and learning through
Mhm.
AI tools.
Mhm. What would you say, just to build upon that, to a new medical director, maybe not so new medical director, but newly implementing some type of AI technology in their healthcare system?
Yeah,
What would you say to them today about, make sure you do these, if nothing else, do these three
yeah,
things to make sure you build that trust among your, nurses, doctors, et cetera.
right.
How do you go about, like, what are the tactical things they should do?
Well, I think any of us have an obligation first to understand a little bit about the technology. So we
Right.
have a role to play, a task to undertake to learn about AI and to read and to understand it. Don't overestimate your knowledge. Don't underestimate, but try to learn. That's the first thing I'd say. Second is if you're in an organization, I think you want to find like-minded people and who are interested, who are trying to learn themselves. And I think groups should be, probably are in many places, forming, whether it's a committee, to help guide introduction, implementation of AI. And so that's a second thing to do, get together with others. Third is, I think, really reach out to and engage with the IT organization because
Hmm.
they're trying to help, but at the same time, they really can't make great decisions unless they're paired with the clinicians. So it has to be the technology people coordinating, working closely with the clinicians. And I think
Yeah.
those are the three things that I would suggest to frontline clinicians to do.
Yeah, thanks for that. So learn, right? Know a little
Yeah,
bit about what
learn
you don't have to be an expert, but you should certainly try and learn, know what you're talking about a little bit.
exactly.
Find like-minded individuals, right? To your point
Yes.
about committees. And then I love what you said about make sure your IT folks like join forces. Your IT
Yeah.
folks don't understand the medicine, so make sure that
Yeah.
you're forming those partnerships. That's
Yeah.
great. That's
They
great.
want to help. They can't do the clinical part themselves. They want to help. They need guidance. I mean,
Mhm.
I
Mhm.
think in that and all those sets of dialogue is where you get to the
Right.
best answers. And then
That's
you got
right.
to go outside of your organization and look at what other leading organizations are doing. And I think you always have to be a little bit skeptical
Mhm.
of everything so that you're not just swallowing it hook, line, and sinker.
Yeah. Yeah. Healthy skepticism. Ask good
Healthy.
questions.
Yeah,
Right.
absolutely. Yeah.
That's great. Let's talk a bit more about leadership, just
Mhm.
generally. You've had multiple leadership roles. Leadership is not easy. And we know many leaders are grappling with how to both run a successful organization just
Yeah.
operationally, but also as part of that, you really have to be able to inspire and motivate teams. So,
Yeah.
what are some strategies you've leveraged in your career to lead through complexity, through change, through adversity, which, quite frankly, I would say is the norm nowadays?
Yes. Well, great question as well. I think if I look back and think about my own career, probably the first uh, venue that or opportunity that I had was just watching other people, watching leaders, existing leaders, and learning from them by watching and also by engaging with them, talking with them. And that's not to say that, whoever is in your environment that is a leader in a leadership role is necessarily a great leader. They might be not so good. They might be pretty darn good. But, you have to kind of learn these things a bit on your own, and it also takes practice. I think one of the things I learned fairly early in my career was, even though I had had some training as a business school and learned a lot from sort of the academic world, that was a lot different than going out and actually doing it,
Mhm.
and there's nothing that beats experience, uh, and so you have to do all of that. Um, there's some people who have a natural sort of talent, if you will, their personality, their just the way they think and interact with other people. They're probably naturally just going to be better as a leader than certain others. Some people are, they make their impact in a little bit quieter way. And then there are people who might be very um, socially engaging as a person, have what we would think would be a lot of leadership skills and tendencies, but not all of them are successful. So I think one of the things you have to do is you have to earn trust from other people. People have to see you make decisions and make them clearly and with good thought and reason. You have to be expeditious. You can't wait for answers to emerge. You've got to act. And most of the time when you're acting, it's without all the information you would like.
Yeah.
So, but you still have to make a decision. And so those are some of the things I think about. And one of the things I've had a great opportunity to do over, a long career is work around and be in the presence of some pretty amazing leaders and to watch them, and just try to learn as much as I could by being around them, watching them, getting to know them.
Yeah. Yeah. And I'm hearing a theme as you talk about leadership, which is learning and being an
Yeah.
observer.
Yes.
And you also talked about nothing beats experience. Maybe that's my own words or
Hmm.
paraphrase, but you got to get the experience. But also, I heard you talk about kind of everyone has a different natural tendency or personality, if you
Yeah.
will, but also needing to be authentic to who you
Right.
are.
Right.
Um, so I really appreciate that. What do you say to a leader who wants to do a good job, is observing, all of that?
Hmm.
How do you practice self-care as a
Yes.
leader? And it goes back to what you said about
Yeah.
individuals understanding how to promote their own health.
Right. Well, you just have to tune into it. And it's important to, question along the way. Am I enjoying what I'm doing? I mean, there's a fine line between it's challenging, it's tough, I enjoy it, and I really don't like this. I hate it, you know? So you got to
Yeah,
be honest with yourself
yeah,
and ask questions as to why you like what you're doing, why you might not like what you're doing, why it might not be the right setting or the right group of people. Um, and it's always a balance. I think today one of the things I noticed that is different than, let's say, 15, 20 years ago, 25 years ago, is that young people especially tend to move around from one job to the next,
mhm,
and they don't stay in the slot very long with a company. It's okay if you're moving, to a different role within a company, but I think that you lose uh, something by not staying with. I mean, everybody gets, not everybody, but many times people get offers that are just better offers, and if that's the case, you probably ought to take it. But uh, there's something to be said, in my opinion, for sticking with something towards achievement of a certain goal or set of goals, and not just sort of pinballing from one thing to the next. After a while of doing that, let's say 10, 12 years, if you're presenting yourself anew to somebody else, they're going to look at that and just say, I don't know, why would I invest in this person? they may not want to be here a year from now. So that's just, that's a between the lines set of thoughts for
Word,
in today's world.
words of wisdom. Thank you.
Yeah.
Let's switch back to health care. And one of the goals of In Service of Health, this podcast, is to really lean into how can different sectors work together? How can public health and healthcare work together? How can the private sector and government work together?
Yeah.
With, again, your storied career, how can leaders in different sectors work together and better to really improve health outcomes and greater access to care?
Yeah. Well, they can't work together unless they share some similar goals and objectives. And I think identifying those is really important. So, for example, if it's a given community, you could imagine, leadership from a hospital, physician leadership, public health leadership, employer, or even all those different parties gathering in some kind of forum and pursuing a set of objectives, whether it relates to improvement in childhood health, and a reduction in obesity, a reduction in diabetes, all these things that cause some mental health. And it really does require collaboration across different groups. I mean, that's just the case. The government, whether it's at the state or federal level, is involved in financing so much of the care. So they probably need to be at the table. But so do all of those providers, whether they're individual clinical providers or institutional. And I think that's where you get answers and directions, and hopefully, a set of plans, go forward plans that are going to result in better outcomes.
Mm-hmm. Yes, collaboration, finding the
Yeah,
common ground. It's something
yeah,
that I think we all need to lean into a bit more
we need
in these
that.
time. Thank you for that. So, last question. What is just one actionable tip, resource, piece of advice you'd recommend for colleagues who are really working to try to enact change at scale to improve the health of communities?
Yeah, boy, these are tough questions. I'm trying to imagine, like being that person, and how would you go about it? I sort of turn to the thought that to get anything done of a sizable impact or scale requires multiple points of influence and power. So when you're stepping back from a situation, trying to do something about it, you really need to honestly survey, who can have some influence over this issue or this situation. So, for example, when I was at the Department of Defense, a certain issue, it doesn't matter what one it was, but there were certain issues that I and a team of people, within my organization could come together, debate, decide, and move forward. There were other things that were much bigger that might have cut across all of the Department of Defense, or that leaders who were not physicians, they were the general line leaders or the policymakers, or even another federal department had, as they say, some equity in that decision or those decisions or policies. So when that is the situation, you need to be mindful of that, and you need to connect with, and ideally you have a prior relationship with those different points of influence, and you come together and then chart a path forward and agree on something. That's why Washington is so hard to get things done, because you have all these government groups and agencies and departments and individuals and everybody's got kind of an agenda. And then you have Congress, and you have all of those, individuals, and then you have two political parties, and then you have the media, and then you have people who want to make money off of all of it. So it is no small task to figure
Yeah.
out how to move the ball down the field, but it can
Yeah.
be done, and it's very satisfying when that happens.
Thank you for that. Thank you for that last note of positivity. It
Yeah,
can be done. That's right.
it can be
Well,
done.
Dr. Winkenwerder, thank you so much for joining us today.
You're
Thank you for
welcome.
your insights and your wisdom and for being on our show today.
Thank you very much. I've enjoyed it.